Cranial nerve 1, show on the video. This is cranial nerve 1, olfactory nerve. You point to it, you say olfactory nerve, cranial nerve 1. It's responsible for olfaction. And we can test for it by giving our subject something to smell to see if they can discern it. And cranial nerve 2, optic nerve, allows for vision, allows for the sensory arc of your pupillary reflex, your consensual reflex. Okay, and we can test later along with number 3 when we do use a light. And for 2, cranial nerve 2, optic nerve, you can also do a Snellen chart to check for their visual acuity. But the one that we can test now is the confrontation test to test for peripheral vision. So I'm going to have you look at my nose and tell me how many fingers I'm raising.
2.
Okay.
1.
Mm-hmm.
5.
Good.
3.
Excellent. Okay. And you also want to check both sides and have them stare at your nose. So they shouldn't be rotating their eye. Okay. Because eye movement we'll test later. And then so 3, 4, 6. 3 is oculomotor, 4 trochlear. 6 is abducens nerve. All 3 of these cranial nerves control your extraocular movement. They control your extraocular muscle. And 3, in addition, also controls the motor portion of your consensual pupillary reflex. Okay, so we can do the pupillary reflex. Can you cover this eye? Yeah, and then just straight stare right at my nose, and I'm going to flash the light. Make sure they're not looking right at the light because that could kind of temporarily blind them. Okay, and now block the other one. Okay, you do it, and now uncover both. Now I'm going to shine to this one and see if this one now constricts. Okay, and then shine to this one to see if this one constricts. So I want to see if each one will constrict on their own when the light is shining directly into them, but also whether they constrict when the light is shining to the other one. Okay, so that confirms cranial nerve 2 and 3 are intact, but now we're going to test for extraocular movement, extraocular muscles, 3, 4, and 6. Okay, so I'm going to have you keep your head straight and then use your eyes to follow my finger. So I start drawing this H shape. Okay. Great. Awesome. So those are your cranial nerve 3, 4, and 6. And then cranial nerve 5 is your trigeminal nerve. Okay, that is responsible for facial sensation as well as muscles and mastication. We can test for the facial sensation. Is that okay if I touch your touch on the forehead? Does it feel the same on both sides?
Yeah.
Okay. Does it feel the same on both sides?
Yeah.
No, does it feel the same on both sides?
Yes.
Excellent. And then test for the muscles and mastication by, can you clench your jaw? Clench your jaw. Very good. Okay. So that's 5, trigeminal nerve. 6, we already tested with 3 and 4. 7 is facial nerve, which allows for taste in the anterior 2/3 of your tongue, but also muscles of facial expression. So we don't need to do the taste test. The muscles of facial expression, can I have you raise your eyebrows? Good. Can you puff out your cheeks? Okay, can you show your teeth? Okay, can you grimace? Like, okay, yeah, grimace. Yeah, okay, that's good. That's fine. So that's 7. 8, vestibulocochlear nerve. I forgot each one. You want to show it on the screen. Okay, you start showing. Vestibular cochlear nerve is responsible for hearing and balance. You don't need to do a balance test. Hearing, I'm gonna rub my fingers behind you, and the key is not to rub in front of them because they could be. You wouldn't know whether you're testing their sight or their hearing. Okay, so tell me when.
Yeah.
Okay, good. And then you want to go to the other side.
Yeah.
Okay, so, and then check to see, so basically you're checking to see they're symmetrical, right? For each test, you want to do it on both sides. And then, 9 is glossopharyngeal nerve, which is responsible for, there are two, the taste in the posterior 1/3 of the tongue, but also the afferent portion of your gag reflex. We're not gonna do any unless you really want to for the gag reflex, but you don't need to test for either of those, just state them. Number 10 is vagus nerve, which is responsible for the motor portion of the gag reflex, but also carries sensory and motor information to and from your visceral and abdominal organs. Okay, and so we're not gonna test for those. 11 is accessory nerve. Okay, you show it on there. 11 is accessory nerve. It innervates sternocleidomastoid or your neck, but also your trapezius on the back. So you test for the sternocleidomastoid, which allows you to rotate your neck. I'm gonna ask you to turn your head against resistance. So, good. Okay, now, very good. Okay. Okay, because if it's weak, if that nerve is damaged, you'll be able to push their face to one side. They wouldn't be able to resist that as well. And then, can I have you shrug against resistance and while you try to push it down? Good. Okay, so that's 11, accessory nerve. 12 is hypoglossal nerve, innervates the muscle of your tongue. Can I have you stick out your tongue and then wiggle it side to side? So I should have warned you about that before. And so you're looking for deviation, right? Because you have one cranial nerve 12 that innervates each side. So if one is paralyzed or severed, their tongue, when you ask them to stick it straight out, it would just lean to one side. Okay, thank you very much, Rudy.
Oh, yeah, of course.
Okay, so that's all, and then you're done, right? I mean, great if you could do one take. No, I've had to do. This is like, the reason why I emphasize this, a lot of students